The roll call, please.
Director Garza?
Present.
Director Sorrell? Present. Director Webster Cross? Present. Chair Bott?
Present.
And Patricia Merriweather? Here. Thank you. And for the record, those directors also present. I see Director Harrington remotely connected.
Present.
Thank you. You have a quorum.
All right, thank you, Madam Secretary. I'd like to entertain a motion to allow Chair Bott to remotely participate in the meeting as a voting member.
So moved. Second.
All right, the motion has been made and seconded. Is there any further discussion on the motion? Hearing none, and all in favor?
Aye.
Aye. All opposed? Okay, the ayes have it. The motion carries. I will now turn the chairing of the meeting over to my esteemed colleague, Chair Bott.
Thank you, Director Garza. Appreciate kicking off the meeting here, and I will now turn it to Dr. Makaitis for a brief measles update. And good afternoon, everyone. Glad to be with you.
Good afternoon, everyone, and thank you, Chair Bott. Before I jump into this and before we start the formal agenda, I just want to call out the fact there's a lot of, kind of sensitive information, HIPAA related and otherwise. So I would ask that we maybe defer any specifics around the update to either closed session or we can set up director briefings as well if there's a lot of questions. So I did want to share with the committee an update on the ongoing measles situation in Chicago. As you likely know, there have been 8 cases confirmed within the city over the past week. 7 of those are related to exposures at a large city-run shelter for new arrivals. Cook County Health has cared for 4 of those patients that have been confirmed with measles infection. Because of the scale of the exposure, CDPH has indicated it's reasonable to expect additional cases in the coming days. As such, we've activated our incident command within CCH to facilitate communication and planning. In addition, we're working closely with the City of Chicago, Cook County government, the state of Illinois, and the CDC to coordinate a collective response. One of the main priorities has been to raise awareness and set a low threshold for our clinical teams to think about measles for any patient that presents with fever, cough, or rash. They're extremely common symptoms, unfortunately, with kids. So, it's been a lot of screening that's been happening and isolation that's needed. We have also created updated resources for our clinical teams on the intranet that describes clinical symptoms, isolation protocols, and testing instructions. And we've shared information via all staff emails as well to keep the broader CCH team up to speed. 2 of the confirmed patients visited Schroeder, the professional building, and the Arlington Heights Health Center. These patients later tested positive for measles. In response, we've issued an exposure notification to the other patients, visitors, and staff who may have been in the vicinity during the time that those patients were there. And as a result, we've also issued staff notification and immediate release on Monday. Because measles vaccination is required for CCH employment, we feel that the risk to staff is low. In the general population, however, the risk of exposure is most concerning for unvaccinated individuals as well as pregnant women and children who are too young to be vaccinated. We've shared information about potentially exposed individuals with CDPH and our own public health departments currently doing contact tracing for the Arlington Heights exposure. Of note, there are no confirmed measles cases in suburban Cook County, but we were preparing nonetheless. CDPH has communicated with the providers within their jurisdiction and the other local municipal health departments in suburban Cook. CCDPH and the ACHN facilities are discussing plans for collaborative vaccination and testing efforts as well. And we continue public education efforts to encourage patients to get vaccinated against measles and raise awareness around measles symptoms. We've added measles to our special COVID and Mpox vaccine hotline to best direct patients seeking vaccination and have also created multilingual social media graphics and posters about measles. And then regarding just a quick comment about our broader response to new arrivals, we're continuing to offer medical assessments to new arrivals who've gone through the city's intake process. We've cared for more than 27,000 patients through nearly 78,000 visits and have administered in excess of 73,000 vaccinations. That's across all types of vaccines, the childhood series, as well as flu and COVID. While we've done yeoman's work offering medical services to patients, it's important to note that neither health assessments nor vaccinations have been mandatory. The city continues to review their processes and requirements. Our care coordination team worked over the weekend in support of the city's response and will continue to have expanded hours. We're in daily communication with the City of Chicago about their needs and how we can potentially support with additional vaccination and testing strategies. We're expecting to share more information in the coming days, of course. And finally, I want to emphasize how essential vaccination is to stop the spread of measles. The standard 2-dose series that we typically get as children offers a 97% protection rate. And just kind of for the public, if someone hasn't gotten vaccinated and is able to, now is the time. And beyond that, I really want to thank our team who've been working around the clock on this response, especially Dr. Welbell and the infection control team, Craig Williams and Dr. Hasbrook. Really proud of the response that we've had in the last week or so, both internally and externally. Thank you.
Thank you for the update, Dr. Makaitis. Is there any space for questions from the group here? Questions, comments from the directors? Okay. All right. Hearing none, we'll move forward. Thank you. And I want to just echo my appreciation on behalf of our committee to the team at Cook County Health System for their response and coordination. So thank you. And please let us know how we can be helpful.
Thank you.
The next regular meeting of the Quality Patient Safety Committee is scheduled for Thursday, April 11th at 11:30 a.m. And now I ask if anyone's registered to provide in-person or virtual oral testimony or submitted written testimony to be included in the record. So, Secretary.
We did not receive any registrations nor any written testimony.
Thank you. We'll move on to the action items, and just as a reminder, we've reshuffled the agenda per conversation with the team here. We'll start with the action items, and we'll move to the reports and then closed session. So starting with the action items, we'll approve the appointments and reappointments of Stewardship Hospital Department Division Chairs, and 2 Division Chair initial appointments being presented to be reviewed by Dr. Fagan. Dr. Fagan.
Good afternoon. Chief Medical Officer for Cook County Health. We have 2 division chair appointments. The first is for Dr. Anshu Singh for Department of Medicine as chair of the Division of Postgraduate Medicine. This is to be over our internal medicine residency program. Dr. Singh trained with us, has been with the organization for a number of years. And I'll remind you that the internal medicine program at Cook County is the largest single-site internal medicine residency in the United States. So after a search, Dr. Singh was recommended. I'll be happy to entertain any questions about him. The next is Dr. Deepika Patel. This is for the chair of Division of Allergy and Immunology. This is also a program. The program has been without a leader for some time, but Dr. Patel has served in the interim role and has been with the organization for a number of years. She trained at Baylor in Texas, and then came up here to the University of Illinois. And so, started at the University of Illinois and then went to Baylor for her training, but came back to Cook County. And I'll be happy to entertain any questions. Okay,
Right.
Thank you very much.
Hearing none, thank you, Dr. Fagan. I'd like to entertain a motion to approve item 3A, the 2 proposed Stewardship Hospital Division Chair initial appointments. Have a motion?
I'll take a motion.
Second.
All right, motion been seconded, made and seconded. Is there any further discussion on the motion? Hearing none, all in favor, say aye.
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 All opposed, say nay. All right, the ayes have it, the motion carries. Thank you so much. Now we'll move on to our EMS, MEC reports, and these are the Sturgeon Providence Hospital Med Staff action items presented for approval. Asking Dr. Akintoran, President of our Sturgeon Hospital Executive Medical Staff, to present reports for consideration.
Thank
Dr.
you,
Yes.
everyone.
There you go.
So the first is the credentials committee report for Sturgeon Hospital, as presented to the executive medical staff and now being put to you, recommended to you. This is the list of appointments, reappointments, and changes to the medical staff of Sturgeon Hospital. If there's any questions about that, I'll be happy to take the questions. Barring none, I will go to the highlights of the HQIPS meeting, summary of the minutes from the HQIPS meeting of January 2024. Oh, thank you. Okay, all up there. So these are some of the highlights. Imaging services. Inpatient turnaround time for start CT exceeded the goal of 4 hours in August, September, and October, as reported at that meeting in January. Also, another highlight is the emergency department turnaround for that CAT scanning all shifts without trauma. Average 2 hours and 10 minutes. To put that in perspective, that is much better, much improved to where we were before. I won't give numbers, we're talking about maybe 4 hours, 6 hours. So this is a great improvement. Thank you. Then patient feedback, the preferred feedback method of contact for the fourth quarter was in person, 14.8%, followed by phone call. This is, part of the tactics that we're using, to kind of increase those feedback methods. Okay, next one. One goal of patient feedback is to ensure that every Cook County Health facility has adequate access to advocate services, and we are doing good with that. Another one is patient feedback is to use goal of patient feedback is to use data to leverage organizational improvements that align with the patient bill of rights and to comply with regulatory standards. In the pharmacy, prescription and dose volumes for January to December 2023, including these very high numbers, which actually is good. And then temperature loss on refrigerators were recorded at 100% of time in December 2023, and vaccines were not stopped on the expiration date in third quarter of 2024. No action items were presented to the MS committee on this, and we are now recommending any action items to the QPS committee today. Thank you.
Any questions from directors? All right, there are no action items for the MS committee or the QPS committee. And Dr. Paul Allegretti, President of the Provident Hospital Medical Executive Committee, was unexpectedly unable to attend today's rescheduled meeting. The proposed Provident Hospital medical staff action items were sent in advance of today's meeting, presented for the committee's consideration and approval. So I'd like to entertain a motion to approve item 3B, the Georgia Hospital and Provident Hospital medical staff appointments, reappointments, and changes. Motion.
I'll make a motion.
Second.
Motion's been made and seconded. Any further discussion on the motion? Hearing none, then all in favor say aye.
Aye.
All opposed say nay. Ayes have it. Motion carries. We'll move to our items for minutes and other reports. So the February minutes were approved at the February board meeting, so being presented for the community's review and discussion. Are there any corrections or questions related to the minutes from directors? Okay. I'd like to entertain a motion to accept item 3C, the minutes of the QPS committee meeting of February 15th.
So moved.
I'll second. Nope.
Motion. The motion has been made and seconded. Any further discussion on the motion? Hearing none, all in favor say aye.
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 All opposed say nay. All right, the ayes have it. Motion carries. So now move to our operational excellence part of our meeting. Start with the operational excellence strategy planning and deployment, reviewed by Raji Thomas.
Good afternoon, everyone. We are presenting the data in a new format this month based on the feedback we received after the last QPS meeting. This was included as an appendix in your packet. So we will send the information. So for Georgia Hospital, under the patient experience work group metrics, the group is presenting on two separate metrics, rolling 12 months percent top box for communication with nursing domain, We are also, based on the feedback we received, we have also included the monthly percent top box for communication with nursing domain. As you can see, our target is 73%, and we are moving towards that goal. The team presented to this committee last month with the details around their specific actions as well as the timelines to, get to accomplish those goals that they have set at the subcommittee level. The next metric that we have for the patient experience work group is around survey response rate. We have both rolling 12 as well as the monthly survey response rate included in the report. The goal is 15% survey response rate. However, for the monthly rate, we are at 10%. As we shared with the board last month, the team is working on correcting some of the opportunities we identified with how the data files are being submitted to Proscaming. So that work continues. For the clinical outcomes work group's metrics, we are presenting on 5 metrics related to various HAI. In addition to our targets, we are also including SIR rate for those HAI wherever it's applicable. We are projecting 12 Class Cs for this year. As you can see, for January, we had 1 Class C. We don't have the February data yet because it's there is a little bit of lagging with how the data is collected, infections that need the clinical presentation, and then it goes through validation process with our infectious disease team, as well as we wait to make sure there is NHSN, data back before we present here. So for CODI, as you can see here again, our projection for 2024 is 12 infections, for the whole year. In January, we had 1 case of CODI. For Class C, for CD, we had 2 cases. And then for VTE, we are still, it's within what we are projecting for 2024. And of course, to see if any questions so far before I continue.
Yeah, and including questions and feedback on this format from the directors would be appreciated as well. If there's ways that we can continue to represent this one and to try to get it on one page and then just focus on the areas that need discussion.
Thank you, Director. But for that, if you have any input into how we can make this report more actionable, more concise, we would appreciate that. This is definitely a work in progress. And then with established cadence for, work groups to come and present to the board, we also want to make sure the information we present here is not duplicative and, repetitive. All right, under the readmissions work group for Georgia, the team is presenting on 2 separate metrics: rolling 12 months, all cause, all payer, all age, CMS definition for readmission to the same hospital. As you can see, the lower the number, the better, and we think we are on the right track here. The numbers are trending pretty good here, positively here. For the IHA rolling 12 months, all cause, all payer, readmission, including other hospitals also, the numbers are looking really good. Target is 13%. The most recent data that we have, shows we are at 13.84%. For the case mix index, clinical documentation work group is presenting on CMI overall, CMI medicine, and CMI surgical cases. So the higher the number, it's better here. The most recent data from the end of the year shows that we are also trending in the right direction. Moving on, and on the second page, you would see the same information presented in a graphical manner, just to provide additional visibility to those data points. Moving on to the Provident dashboard. The Provident patient experience work group is presenting on rolling 12 months percent top box for communication with nursing domain. The target is 79.8%. In February of this year, rolling 12 months was 78.86%. Just to make a point of clarification, what we report publicly is the rolling 12-month data. However, we received some feedback last month that it would also be helpful to have monthly data added to this, this report. The second metric that patient experience work group is presenting on is the survey response rate. The target is 18%. That's still work in progress. As we shared with the board in the past, we do realize that the volume of responses we receive back at Providence is low. So that's something the team is actively working on. The clinical outcomes work group is presenting on a sepsis 1 bundle complaints, which, as we discussed with the board in the past, this year, the team at Providence will be focusing on mimicking, replicating, the successful strategies we had at Georgia, at Providence. So that work is ongoing. For monthly handheld, yes.
Just, what was happening in June of 2023 that allowed those response rates to be, pretty significantly higher than where they are?
But would you mind repeating that question? I missed you.
If I look at the Providence data for June 23 on the survey response rate, we're seeing 17.40% on the monthly rate compared to where we are for January 2024. I just was wondering what was happening from a strategy or environmental perspective that allow for the rates at that level. It's near your target.
Yeah, it's very fluctuating right now for Providence. At this point, it looks like it was just, like an outlier, positive outlier. But, I do not feel like there was anything, strategy driven. But again, we are hoping that the direction we want to move on to. But though, there is no other. It seems like it's an outlier for that month.
I would just add that I think, volumes in general are very small. So, an extra 2 or 3 surveys that come back in 1 month is going to double the response rate almost. So I think it's, it's easy to kind of swing between 8 and 16%. So.
Okay. Yeah, I just wanted to make sure it was a volume issue versus anything else.
And do we have any information, when it says clinical outcomes, but on the outcome of the patient?
Clinical outcomes actually is a work group that's working on clinical outcomes. And the next to what you see is the metrics that work group is, reporting on, that they're working on, the additional strategies and additional efforts that are currently underway. But we are only reporting 2 of those metrics that they're working on.
Okay, it's really just the bundle compliance?
That is part of the work that's happening, definitely. For sepsis as well as the other HAIs that we presented on at Georgia, the one of the strategies that the team is working on is around bundle compliance for those HAIs. There are specific strategies like, daily evaluation of the need for the catheters and lines and, other measures that they are continuously monitoring. There is a subgroup that's looking at present on admissions documentation in ED, so multiple strategies. This team would be readmission, the clinical outcomes team would be coming to the board next month to present on those specific tactics as well as their timeline for accomplishing those goals.
Okay, because one of the key factors for outcomes, the life expectancy, because sepsis can advance quickly, is how quick the patients also present themselves at the hospital. So the education component as they're being discharged, or the community component, is really important for sepsis. It truly is.
Yeah, completely agree. I would also share that what we've seen in kind of getting into the details of the work is that our teams are exceptionally good at recognizing fully fledged flourishing sepsis, right? So
Right.
they really jump on that, and I don't think they've ever missed a case.
Mhm.
The one that's fallen out. It's those kind of middle of the road, we're kind of edging towards it, where they, that's where I think a lot of the improvements really happen in terms of bundle compliance. Since they're coming next month, we can probably, I know on Vizient, we can give kind of mortality rates and all of that kind of stuff. So
That
we
would
can
be great.
kind of give a little more robust, deep dive, yeah.
Thank you.
So moving on to the hand hygiene complaints. For Provident, our target is 80%. The most recent data that we have shows that we are at 75%. There are a number of initiatives currently underway at Provident to increase those numbers, including having a hand hygiene program with champions and, really real-time bedside feedback on, anytime they identify any outliers. So, again, reinforcing the real-time feedback using CI care framework, all within, our expected values of behaviors at CCH. All right, moving on to the ACHN dashboard. Patient experience team for ACHN is presenting on the rolling 12-month data as well as monthly data on concerns of nursing or assistants, explaining the problems clearly. Our goal is 61.34%. We are getting closer. We had a couple very good months, but still, all within the standard deviation. But we are on a right journey there. We are getting closer to our target. Providers explaining problems and conditions clearly. The goal is at 66.8%, and we are around 62% based on the monthly data, and for rolling 12-month percent, we are at 65%. Courtesy of registration staff, as we explained to the board in the past, this is a new metric that ACHN started measuring. We are trending in the right direction. Our target is 60%. We are at close to, our target when we look at the monthly data, 63 to 58% in the last couple months. HEDIS measures, again, this team will be presenting next month. We have for hypertension management, target is 55%. But current data shows we are pretty close to our target of 55%. We are at 53 to 54% for the past couple months. For cervical cancer screening for both engaged and affiliated patients, the target is 47%, and we are at 46%. So that data trend also looks very good. Any questions for me?
I do. I have a question regarding the left without being seen. It looks like we're trending up, and we should be trending down. Is that related to staffing?
Dr. Westercross, is that for Providence?
Throughput for Providence, yes.
Left without being seen, actually, that is, we are doing very good. It's at 5.55% for February. So as we shared with the board in the last meeting, we launched that initiative on February 14th. Since then, the numbers have really come down. Prior to implementation, we were at around 12%, but since then, it has come down to 5.5%. And we believe, I think the most recent data is even better than that. We are at 4%. Dr. Tara just, just said to me, we are at 4%. So we are doing really well. So we took the strategies that worked for Roger, and we mimicked it at Provident. Of course, customized for the Provident ED setup, the layouts and the staffing and everything. But even within this short span of time, less than a month, we are starting to see significant improvement.
Thank you.
All right. Before I close out, I want to make a note of thanks to some folks in this room. I want to really call out the Provident leadership team for being the first in the system to launch the quality governance structure. So thanks to Dr. Taylor for leading the the way for the system. And we also want to thank Director Westercross and Director Harrington for being there. The team really engaged, with the directors in that call. And I got a lot of feedback that they appreciated your thoughtful comments and thought-provoking, questions, and also, offering actionable recommendations during your discussion with us. So the goal is then for CERMAC to follow Providence, and we are hoping that we will be able to launch CERMAC Quality Committee next month. That's all. All right. Thank you.
Thank you. Are there any questions or other comments for Raji?
Do you have any input on how we can make this report better and more engaging? I would appreciate if you could give me that feedback after the meeting. Thank you.
Well, thank you to you and the team, Raji, for helping enhance the approach, and more to come as we get this to a nice place in terms of the data and acting on it. Okay, we should go to the next report. It's regulatory and accreditation updates reviewed by Cynthia Fish, our Director of Quality and Regulatory.
Good afternoon.
Good afternoon.
Okay, thank you. Okay, so my brief update here for March. Actually for last month. So at Providence Hospital, we continue to present the audit data from the Joint Commission triennial survey that we had, and continue to report out that audit data. The compliance of that audit data is also presented at select hospital committee meetings, so that is ongoing. And then at Stroger, corrective actions are underway for the findings of the mock survey that we had done. Actually that just started today. And also I'm pleased to say the primary stroke certification program successfully completed their intra-cycle call with Joint Commission, and we received a pass certification decision from the Joint Commission. So that was a great experience. Any questions?
Very good.
Okay, thank you all. Thank you.
Okay, thank you so much. We will now, the committee will now be going into closed session. Action is not anticipated to be taken in open session if the closed meeting has adjourned. So I'd like to entertain a motion to go into closed meeting.
I'll make the motion.
Second.
Thank you. Motion's been made and seconded. Is there any discussion on the motion? Hearing none, then Madam Secretary, please take the roll call vote on the motion.
Chair, but before we do, can I just reference the exceptions to the Open Meetings Act that we are going into closed session for?
Yes, so I will, pursuant to the following exceptions to the Open Meetings Act, 5 ILCS 120.2, C 1, 11, 12, and 17. Thank you.
Thank you very much. Roll call on the motion to go into closed session. Aye or nay? Director Garza?
Aye.
Director Sorrell?
Aye.
Director Webster-Cross?
Aye.
And Chair Bott?
Aye.
You have 4 yeas and 0 nays.
Thank you. So we, the ayes have it, the motion carries. We'll now go into closed meeting. So if the members of the public and those staff who are going to be in attendance can please exit the room, we can get started in a few minutes. Thank you so much.